Okay, we're going to talk briefly about a prenatal history. It's really unlikely that in 30 minutes this would be information that you would gather for the final assessment. In fact, if you're starting to take, unless you have a toddler, if you're starting to take prenatal history, you've probably gone off the rocker and will not pass the class. So good thing not to take prenatal history in the 30-minute assessment. However, you will need to know how to do it for your career. When I talk about prenatal history, we're talking about your client's development beginning at conception, typically through a couple of years old, okay? So we would ask questions, and often people don't know this information. This is often very, very hard. Moms typically know this information for their children. Okay, but people typically don't know unless they had very verbal moms talking about their pregnancies or their developmental milestones, may not know this information. So questions that we would ask would be, how were you normally conceived, or was it in vitro fertilization? So that would be important. Was there any exposure to substances or toxins during pregnancy? And that could include anything from drinking or smoking, or substance abuse in the womb, to parents who may have had exposure to chemicals. So say, for instance, they worked in a paint factory while pregnant. We would be concerned about those sorts of things. We would want to know if as a child the person was a full-term baby or they were premature. Was it a typical birth? So were there any complications during pregnancy? Did the baby stall in the birth canal for a long bit of time and have oxygen deprivation? Were there issues around really long labors that had to be induced for C-sections that may have caused some oxygen deprivation? Primarily we're worried about at this point. After the baby's born, then we talk about developmental milestones. For instance, when did the baby sit up, crawl, hold something in his or her hand, roll over, would all be things that we're talking about. And there are pediatricians have charts about when these things should happen. And so we typically talk about a range. So people, and it can be a pretty big range as well. Girls typically do these things earlier than boys. First babies tend to do them earlier as well because of, again, additional attention from parents typically. We would talk about walking, when children walked, all the way up to development of like fine motor skills, like ability to cut with scissors or use a pencil. And typically we stop talking about those developmental milestones in about the kindergarten. For children who are on the spectrum of autism, now in the new DSM-5, there would be delays in developmental milestones. And so we would talk about like speech, when it should happen, when single words should happen, when sentences should happen. And for kids on the spectrum, we're going to see really significant delays. Likewise with kids with Down syndrome or other kinds of genetic or birth defects, we're going to see pretty significant developmental delays. It does not mean that they will not happen, it just means that they're often behind. Likewise with premature babies, they're often behind their developmental milestones. And so that sort of information would be important. Typically pediatricians talk a lot with parents about this, and so if you can't get accurate records, pediatricians would be a place to start. Also, screening into pre-kindergarten or kindergarten would get some information about developmental milestones and accuracy along the route as well. So those would be places. Again, if you're talking about prenatal history or developmental milestones as part of your assessment, you're probably in trouble. However, in certain placements, Head Start, schools, these would certainly be more important. So that about wraps up developmental milestones and prenatal history.